What distinguishes a narcissist from a sociopath? You might have used the words narcissist and sociopath to describe someone you encountered who was difficult to get along with. These two terms are not interchangeable, despite some resemblance. The words narcissistic personality disorder and antisocial personality disorder actually relate to two different personality disorders. You might be able to comprehend people with personality disorders better if you have a better understanding of these critical ailments and how they differ from one another. A narcissistic personality disorder and narcissistic behavior. When a person exhibits pathological personality features, they are said to have narcissistic personality disorder. To put it another way, a personality trait or traits may be so extreme that it is difficult for the person to function in relationships, the workplace, and society. Several personality qualities could be present in someone with NPD. Self-centeredness, conceiving of themselves as special or superior to others. Entitlement, requiring the admiration and focus of others. Envious of or thinking others are envious of them. Being unresponsive to criticism, acting like a victim. Being unresponsive to criticism, acting like a victim. You could assume that someone who exhibits these personality qualities is conceited or self-centered. Yet, the distinction between general narcissism and someone with NPD is that the latter has a chronic disorder that can seriously impair daily functioning and interpersonal relationships. Many instances of how NPD impacts someone are as follows. When they set goals for themselves, they rely on other people's approval. They risk falling behind in their work or their studies if they don't get approval. As a result, you can lose your job or experience academic probation. Extreme mood swings are a possibility, and they lack empathy for others. This could destroy current relationships or result in superficial ones. The following are some risk factors for having NPD. Genetics, childhood trauma, excessive praise bestowed upon children, antisocial personality disorder, and sociopathy. It's common to refer to people with antisocial personality disorder as sociopaths. Without feeling regret for their actions, sociopaths frequently cause harm to others or commit crimes. A person with ASPD could be any of the following, according to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, a diagnostic tool created by the American Psychiatric Society to detect and categorize mental disorders. Manipulative, deceitful, aggressive, harsh or sadistic, hostile or unforgiving, impulsive, irresponsible, inconsiderate or callous toward others, vulnerable to boredom, enraged or irritated by even the smallest criticisms, unable to or having trouble creating and carrying out plans. Your treatment of yourself, interactions with others, and social interaction can all be impacted by these personality qualities. Those with ASPD may frequently disregard others' needs in favor of their own selfish priorities, have trouble forming or keeping tight ties, be threatening, controlling, or abusive to others, struggle to find or keep a job, disregard social conventions or laws to avoid potential legal repercussions. A substance use disorder and violent crimes may be more common in ASPD patients, as well as financial fraud. They also have a larger chance of being imprisoned, according to studies, as 40% of inmates have ASPD compared to 4% of the general population. ASPD frequently begins to manifest in childhood. The following are some risk factors for developing APD. Genetics, having an ASPD or substance use problem in a parent, being excessively hostile as a child, ADHD or a conduct disorder as a child, having been animal abusers as a child, a background of physical or sexual abuse. Sociopathy versus narcissism differences. There are two distinct personality disorders, NPD and ASPD. Each illness is characterized by distinctly different actions and motivations in its sufferers. Getting along with others. A person with NPD frequently behaves selfishly and vainly. They might need continual affirmation and attention from others to keep their egos up and their spirits up, immediately becoming disagreeable, rude, or frigid if they don't get this appreciation. A person with ASPD typically doesn't care what other people think of them unless they're out for retribution. They do not require approval from others and are contemptuous of other people's worries, recognizing social laws and norms. A person with ASPD often lacks regard for authority figures, social conventions, and agreements made with others. They frequently disregard norms and other people's judgments in favor of concentrating on their own demands and desires. NPD patients are more inclined to follow the law and social standards. They might also be less hostile and dishonest with other people in society, lacking in compassion. NPD and ASPD sufferers frequently lack empathy and have a tendency to injure others. A person with NPD could harm and take advantage of others because of their own obsession with themselves. They frequently don't show consideration for others since they are self-centered. Their behavior is often driven by their social standing. Due to impulsivity, boredom, or the need for vengeance, a person with APD may go out of their way to harm a person or an animal. Typically, after hurting someone, they don't feel bad or guilty about it. Their behavior is typically driven by their own needs and desires. Similarities between sociopathy and narcissism. NPD and ASPD are distinct diagnoses, yet they both fall under the umbrella of cluster B personality disorders and have several things in common. A subtype of personality disorders known as cluster B is characterized by excessive emotion, dramatic behavior, impulsivity, and unpredictability. The following are some similarities between the two personality disorders. They can utilize their charm for selfish purposes. Narcissists use it to attract attention and adoration in a superficial way, while sociopaths use it to manipulate people into giving them what they want. People experience difficulty performing daily tasks. Individuals with NPD and ASPD may struggle to manage their finances, keep a job, and keep close relationships. They might be more prone to suffer severe repercussions. NPD and ASPD sufferers are more likely to end up in jail or acquire a substance use issue. They share the following risk factors. Those who experience NPD and ASPD may be at risk if they have a history of abuse or trauma in their early years. Both NPD and ASPD may exist in certain individuals. These individuals are frequently described as narcissistic sociopaths. Being diagnosed with both personality disorders is uncommon and can be challenging. As a result, the DSM-5 does not provide a separate diagnostic for this disorder. Instead, individuals would have to fulfill all requirements for both NPD and ASPD to be diagnosed with both disorders in order to be termed narcissistic sociopaths. Both personality disorders traits would coexist in a sociopathic narcissist. They might think they are superior to others and that the law doesn't apply to them, but they are also capable of manipulating others for attention and adoration while showing no remorse for doing them harm. Treatment. Getting the help that they require might be quite difficult for those who have NPD or ASPD, due to the fact that they do not regard themselves as ill or as requiring help. People with either illness rarely seek therapy. Although neither ailment is currently curable, medical professionals may recommend specific drugs to assist control symptoms or treat other mental health disorders. Long-term therapy may be acceptable to those with NPD. Early treatment of children with conduct disorder can be beneficial, even if there is less evidence to suggest that persons with ASPD react well to therapy. A brief overview. The terms sociopath and narcissist are frequently used interchangeably. NPD and ASPD, however, are distinct cluster B personality disorders. Either condition can make a person manipulative toward others, lack empathy, and struggle with day-to-day tasks. Those with ASPD completely neglect other individuals, while those with NPD act based on the adoration of others. It could be beneficial to consult a mental health expert if someone you know or love has NPD or ASPD. They can assist you in acquiring the skills necessary to take care of yourself, establish boundaries, and safeguard your safety. They could also suggest support groups to you so you can deal with your circumstance.